Hi, everybody. It's Victoria Flynn from the Council on Aging. Today, we are joined with Victoria Nadel and with Lindsey Gainer. They're talking about the new mass gen construction that is going to be starting in Westborough and just giving us some information about what this will be able to do for our local residents. Good afternoon, ladies.
Hi, thank you so much for having us. So I'm Lindsey Gainer. I'm the Vice President of Operations Development for Mass General Brigham Integrated Care, which is a new entity within Mass General Brigham. And we are so excited about our plans for a new facility in Westborough. So I'm going to share my slides and give me 1 second while I do that. There we go. Victoria, can you see my slides?
Yes, we're good.
Great. Okay. Well, so again, thank you so much for having us today. We are really excited about bringing care closer to home for lots of folks in the Westborough area. Sorry. Technological difficulties here. Give me 1 second. Okay. Did that advance to the next slide? Great. So we would love to stay connected. I know not everyone is able to attend today, but this is being recorded. And so we would love to ask for you to send us your contact information. So the other Victoria that's on the line with me today, her name and email address and cell phone number actually are here on the screen. And so we would love to know, who would like to stay connected and learn more about this as we get closer to opening this new facility. So what are we bringing to Westborough? So we are planning a new building that will offer one-stop shopping for our patients really close to home. So we have purchased 9.4 acres of vacant land on West Park Drive in the Westborough Business Park. And we are going to be building a 3-story building that's about 62,000 square feet. And what we're going to be able to offer in this building is really lower cost, high quality care. And part of the way that we're able to accomplish low cost is that it is not actually in a hospital setting. So this is a freestanding clinic. And I'm going to go through on the next slide the types of services that we're going to offer in the building. We already have more than 40,000 Mass General Brigham patients that live in the Westborough area. That today have to drive into Boston to get their care. And so we are thrilled to be able to bring Mass General Brigham services closer to home for those patients. And our goal here is really to offer less fragmented, more coordinated care with Mass General Brigham providers who are collaborating on all of the patients' care needs. And you'll see on the next slide, we are planning to bring a very comprehensive offering to Westborough. And so within this building, we will offer day surgery. So those are, surgeries that do not require an overnight stay in a hospital. Really comprehensive imaging services. So MRI, CAT scans, X-ray, ultrasound, breast imaging. And then lots of different complementary physician services and provider services. So definitely primary care, behavioral health, which we know is a huge need in all of the communities in Massachusetts. And then a specialty complement, you can see a listing here of some of the specialties that we are planning on. The final list has not been entirely determined, and so there may be some things that are not on this list that we do decide to offer because there's a need in the community. But some of the things that we are planning on are cardiology, gastroenterology, orthopedics, pain management, rheumatology, urology, ophthalmology, ear, nose, and throat, and general surgery. And we are also going to offer a lot of other complementary services like physical therapy on site, being able to do lab draws in the building, and also nutrition services. And so you can imagine, as a patient that lives in this community, being able to come to this building, you're going to be able to get most of your needs met that don't require going to a hospital. And just from experience perspective, we really are taking the time to think about how to improve the patient experience with this new offering. And, we did a lot of research with patients and with doctors and with staff members. And what we heard is that today, healthcare feels a lot like the things on the left-hand side of this slide. Patients told us, I feel like a symptom, not a human being. And when I see a doctor, they're looking at one system of my body. So they're only looking at my heart, or they're only looking at my skin, or they're only looking at my nervous system. And what we really want to think of is people as human beings that have a constellation of potentially health and wellness needs, but they also may have needs that don't really have anything to do with medical diagnoses that are impacting their health. And so in order to really drive overall health and wellness, we want to have a much more comprehensive approach to the way that we provide care. Patients have also told us time and time again, and I think all of us are also patients, and we've probably all experienced this, is that care is fragmented. Whether you are managing your own healthcare or your child's healthcare or a parent's healthcare, it is often up to the patient to navigate the system. And this system is hard to manage. You're having to coordinate between different specialists. You're having to drive from place to place. And so we're really striving towards a more seamless experience for our patients and their families. Patients often feel really isolated and like they're not aligned with the care team, and we really are trying to aspire to a much more collaborative model. And then patients also feel very burdened. Everything that I just described, where patients are having to self-navigate and are having to do all of this travel from place to place, it makes healthcare a less than joyful experience. Nobody wants to have to go to the doctor's office or need a surgery, but we would really like that if patients do need those services, they feel empowered, they feel like they are part of the care team, and that we made it as easy as possible. And, you know, healthcare, I would say, as an industry has been a little bit stale. We've done things the same way for a very long time. And so we're also trying to really infuse a lot of new technology and new thinking in the way that we're creating care. And we'd like to partner with patients to be a more dynamic healthcare system and to evolve to meet the changing needs of patients in the community. You know, in the same vein, those shifts that I just described have really driven for us 5 main experience principles. And these have really become a touchstone for us as we are designing the new facilities, as we're thinking about the kind of people that we want to hire to staff these buildings. And so, you know, one of them is defining health together. And I already spoke about that a little bit, but really making sure that we understand that patients come with a story, and that story may have some medical diagnoses in it, but also has a lot of other context. And making sure that not only do we engage with patients to understand their story, but that we also build a longitudinal relationship with that patient to help them on a path towards health and wellness. And that really our model is about relationships. And, you know, we also have, as we're starting to hire people, kindness is our #1 value. And that is really what we're trying to, you would think everyone in healthcare is kind. I'm sure we've all had experiences where maybe that was not the case, but to us, that is the #1 value in what we're the kind of talent that we're hiring. Integrating the in-betweens is another really interesting concept that we heard again and again, that patients shared with us that unless they're having an episode, so going to the emergency room, having a doctor's appointment, having a surgery, they feel dropped. So in between these episodes of care, they feel like they fall through the cracks. Everything that is in between appointments or episodes, they feel really lost. And that is where all of that self-navigation has to occur. We are really trying to build a team and actually putting a lot of thoughts around how do we build a team that is always available so that no one gets dropped between episodes of care. The other thing is that because this new facility is going to be, you know, a community-based one-stop shopping offering, but as part of the greater Mass General Brigham system, we are also a bridge to some of the best academic medical centers in the world if and when that care is needed. Honoring collective intelligence is about not only honoring the people that are on our team, so providers and nurses and medical assistants and physical therapists, but also honoring the intelligence of the patient and what they bring, and making sure that we listen deeply and understand that this will be a collaborative care plan process. Grounding in predictability is something that actually is really important for our patients and our staff. So, you know, patients often say, I have no idea what the next step is in my process. And even if I do know what the next step is, I don't really know what it looks like. And I would say from our provider perspective, sometimes we actually suffer because of variation in our processes. And so trying to put a lot of standardization and predictability into the process, that just lowers everyone's anxiety about healthcare. And then catalyzing change. I talked about this before. We want to be a learning laboratory for how to make healthcare better. for our patients. And so we're, really hoping that patients join us on that journey, and that we can really be on the cutting edge of therapies and treatments. But again, by being able to do that, but close to home for our patients. We're trying to, I mentioned our relationship-centered care model, and this is my last slide. But these are some of the core tenets of what we're really hoping to bring to this community. And one is clinical coordination. And so, I mentioned that before, but there is something very special. And actually, even in the way that we're designing our buildings, if you go into a typical sort of medical office building today, you sort of walk in the door and you have to walk over to a board and look to see what suite your doctor's in, because they're probably either in an orthopedic suite, or maybe they're in a primary care suite, or maybe they're on the third floor in an ENT practice. Our practice is completely different. So all of our clinicians work together. There aren't even any doctor's offices. So the whole care team actually works together, multi-specialty. So you might have a cardiologist sitting next to an orthopedic surgeon, sitting next to a primary care doctor. And if they're all taking care of you, imagine the power of them sitting together and working as a team to coordinate your care. We are also trying to design an always on team. And so any time of day, any day of the week, any time of year, there will be, either through digital technology or through human beings, a way for you to get an answer to your question and information in a timely manner. Navigation is something that is really important to us. And so we feel incredibly lucky to be part of this larger Mass General Brigham system, and to be able to send patients to Mass General Hospital or to Brigham and Women's Hospital or to one of our fantastic community hospitals is huge, but we need to make sure that that care is tightly navigated and coordinated. And so we're also trying to recruit for patient experience navigators who have excellent customer service skills and can actually have that human touch around navigation. Obviously, a lot of what we're really trying to do here is the right care at the right place at the right time. I don't want people to have to drive 2 hours into Boston if we can provide care closer to home. And I really don't want them to drive 2 hours into Boston if we can also provide the same level of high quality care at a lower cost. And so that is really what we're striving for with this model. And then always engaging, always accessible. We want to make sure that in addition to that human touch, that we also, like I said, have digital tools and other ways that our patients feel like they're always in touch with the care team, and that, again, they always know what the next step is in their care. So that's my last slide. I don't know if, Victoria, you have any questions on behalf of the town of Berlin. Again, we're thrilled that you've asked us to be here today, and we just could not be more excited about bringing Mass General Brigham into the community.
No, I thank you both so much. I think that, you've given us a lot of really good information. In terms of the site in Westborough, do you guys have any general idea as to when you think that the building may be able to be open and would start accepting patients?
Yeah, great question. So we are right now in the regulatory process in Massachusetts. And so you may have seen or heard there's been several sessions with public comments. And so we would welcome as many positive comments as you have. I know a lot of folks are really, really excited about this new offering in your community. And so once we have approval from the state, we will then be able to start on construction. And right now we would be slated to open sometime in late 2023.
Okay. All right. And you mentioned other community hospitals as well. Where else have you guys had the locations currently?
Yeah, so we actually, this will be one of our first. That'll be this new model that is not on a hospital license, but it will be a freestanding clinic as part of Mass General Brigham. We are actually going to be opening a similar facility in Salem, New Hampshire next summer, so in the summer of 2022. So if anybody wants to drive up 93 to Tuscan Village, it's just exit 1 right over the border. You can actually see the shell of the building is actually there today. And so that one will open next summer, and that will be a very, very similar model. So it will have day surgery, it will have the multi-specialty clinic and imaging. There is also a location planned in Woburn, and then we are expanding a location in Westwood. All three of those sites are going through this regulatory process. We do actually have some prior examples of ambulatory sites, a little bit similar. The model's a little bit different. So we have one in Waltham that is run by Mass General. There's one in Danvers that is a collaboration between Mass General and North Shore Medical Center. And then we have the one down at Patriots Place in Foxborough that is a Brigham facility. And so we've had a lot of really amazing lessons learned from those facilities that we're really carrying forward a lot of that wisdom into these new facilities as well.
Nice. You had mentioned a lot about the having, different providers in a room at the same time, which is awesome, just to have that collaboration of care and just, to kind of have like that whole body or that whole mind approach for something. Is there, when patients come in, is there like any paperwork like regarding HIPAA, or is there any concerns, like if somebody had any concern about like their privacy and things like that, how does it work with just kind of like this, multi-tier approach?
Yeah, so great question. So typically, making sure that we have good understanding from our patients around privacy and HIPAA would be standard practice across all of Mass General Brigham. And so we would be following the same policies and procedures that we would follow at any Mass General Brigham location. The idea of being able to do those multi-specialty visits, they would be established relationships, with those providers. And so everyone would be held to the same HIPAA and privacy and confidentiality, standards.
Awesome. Yeah, I mean, it sounds like it's going to be an awesome layout once it comes to be, and like you said, it's gonna hopefully, it's going to get up and running soon, and it will save people, like you said, a lot of time, a lot of money, and hopefully a lot of easing of stress and of worry, especially if it's a tough diagnosis. It
Yeah.
sounds like, knowing that you're going to have staff support no matter whether it's by phone, by video call, or by, in-person
Mhm.
visit, that can be a lot. So, I mean, we appreciate you not only caring for our residents, but also their families, and their loved ones as well, because it's huge. It really is.
Yeah, thank you. I mean, it's we took the research with the patients and families really seriously, and we heard things like that over and over. Is that we, unfairly burden our patients and families, and it's not that we've intended to do that, but the systems have not really been designed with that as the primary focus, and that really is our primary focus: is making sure that care is easy and high quality, and that again, kindness is our number one value in everything that we're doing.
Has COVID changed like the plans, or has changed the way that you guys have thought about doing things? I'm sure, like, I mean, everybody's had to learn to adapt for different things, but I'm just
Yeah,
curious, like, if that's tweaked it.
it's a really good question, and it's so funny. I will say I took this role in December of 2019, having no idea what was coming, and so it did obviously slow our plans down quite a bit. We right in the middle of the first surge, obviously the number one public health priority was COVID and the safety of our patients, and so a lot of things were frozen in terms of capital and construction and hiring, which was all completely appropriate. And most of us pivoted our attention to the crisis at hand. And so I, for example, I'm a nurse by training, and I did some help with the COVID response. As we have settled into this new normal, we have actually had a lot of lessons learned. One concrete example that I'll give you is we were always planning, even before COVID happened, on a very virtual forward approach and making sure that we had, video visits available for our patients. And we had some early experience across Mass General Brigham that obviously got seriously fast-tracked during COVID. And turns out people love video visits. They're incredibly convenient, and you can actually care for many, many conditions safely, more seamlessly, and easier. I know one clinician was telling me an example of this clinician happens to take care of a lot of aging patients. And she said, video visits are the best thing that ever happened to me and my patients, because often patients have lots of different medications that they're taking. And, I always say, bring the brown bag with your medications, and people forget, or, they don't have time. And she said, now I just say, walk me over to your medicine cabinet. And she can actually look and really do what we call medication reconciliation, which is looking at all the different medications and saying, oh gosh, you've been filling that blood pressure medication that we thought was off your med list. And so that's why you've been falling. And so there have been so many benefits to virtual care that I think, again, got accelerated during COVID that are absolutely now going to be fundamentally part of our care model.
Nice. Yeah, it sounds like it. it's unfortunately our new normal for right now. And,
Yeah,
but like you said, it's meeting a need, especially for people who, like our seniors who may or may not be able to easily get around, or even like somebody with like a young family who may not, always be able to get the kids off to like a babysitter or something like that. It's
exactly.
really a nice, kind of blend of care. I mean,
Yeah, yeah, absolutely.
awesome. Well, I thank you both so much for your time. I mean, we'd certainly look forward to hearing, we hope that you guys get through the next process. I'm, fingers crossed. Don't see any reason why it shouldn't, but fingers crossed regardless. And, like I said, just, please keep us posted on, the construction and anything like that. But I mean, I definitely think, especially since these providers, are, just like those, at the hospitals themselves, they're now coming out here to Westborough. It's going
Mhm.
to save a lot of time, a lot of energy, a lot of stress for our residents and for their loved ones. So we're very happy that you guys chose Westborough. So thank you very, very much.
That's great. And we so appreciate your support. Like I said, please do email or call Victoria with your contact information. We would love to keep you posted. There will be a lot more information coming, and we would love to come back anytime. Hopefully, again, in a few more months, maybe we will really be back to normal and we can come in person. Nothing would make us happier. And, we look forward to the hopeful ribbon cutting in the very near future, and bringing this, this wonderful facility and the services out to your community. So thank you so much again for having
Yeah,
us.
absolutely. With our van service, I suspect we'll be making some trips out to Westborough.
Yeah,
So looking forward to it.
great. Thank you so much.